H1. Medical testing after 60, when less can be more. An 80-year-old gentleman visited his physician for his annual wellness exam. Fit, energetic, hitting the tennis courts twice weekly. No concerns, no discomfort. His physician recommended a PSA screening for prostate cancer. Typical procedure for gentlemen in his age bracket. The numbers returned mildly raised. Nothing alarming, simply somewhat beyond the standard range. His physician suggested, let's proceed with a biopsy for precaution. That biopsy triggered a serious infection. The gentleman was hospitalized for 7 days, requiring powerful antibiotics. At 80 years of age, such an infection can progress to sepsis and prove fatal. The biopsy revealed cancer. Slow progressing, early detection. His urological specialist advised prompt surgical intervention. But here's the critical detail nobody thoroughly communicated. That malignancy would require 15 to 20 years before creating any complications. His reasonable life expectancy, considering his age and general wellness, approximately 8 to 10 years. Had he accepted conventional medical guidance and undergone the operation, he would have lived his remaining time managing permanent urinary leakage, requiring absorbent undergarments, incapable of bladder management. All for addressing a condition that would never have affected him. This scenario occurs with greater frequency than most realize. Beyond age 60, particular medical screenings that previously safeguarded your wellness can genuinely cause damage. The screenings themselves may appear innocent, yet they initiate chains of biopsies, operations, and interventions that diminish your life quality without contributing a single additional day to it. Nevertheless, physicians continue requesting these screenings. Why? Because it's standard procedure. Because the healthcare framework is constructed around younger, healthier individuals. Because the medical system incentivizes additional testing, not improved results. A groundbreaking research paper released in JAMA revealed that 91% of physicians never authentically explore the drawbacks versus advantages of these screenings with their aging patients. They simply request them, you authorize the paperwork, and the chain reaction starts. So today, I'm going to guide you through 5 medical screenings that are consistently requested for individuals beyond 60, yet that you possess complete authority to challenge and in numerous situations decline. I'm Jennifer Blake. For more than 2 decades, I've been assisting older adults in understanding healthcare choices. And this discussion, most physicians won't engage in it with you, but I will. This isn't about rejecting all medical attention. It's about forming educated choices that emphasize your life quality. Because beyond 60, increased testing doesn't invariably mean enhanced health. Sometimes it represents the reverse. P. If you discover this content helpful, please press the like button and subscribe. This type of transparent dialogue about elder healthcare isn't widespread, and your engagement allows me to keep producing these videos. P. Let's start. P. Test number 1. PSA screening after age 65. The initial screening to challenge is PSA testing for prostate cancer beyond age 65. The U.S. Preventive Services Task Force clearly advises against PSA screening for gentlemen over 60. Not perhaps evaluate it. They state avoid it. The disadvantages exceed any possible advantages. P. Let me share the story of Thomas Henderson, the 80-year-old from the introduction. He was healthy, energetic, hitting the tennis courts twice weekly. His physician requested a standard PSA screening. The figure was somewhat raised, therefore a biopsy was suggested. Key. That biopsy requires inserting 10 to 12 needles into the prostate via the rectum. For Thomas, it produced a serious infection demanding a week hospitalized. At 80, such an infection can transform into sepsis and become life-threatening. The biopsy discovered cancer, slow progressing, Gleason rating 6. His urological specialist urged immediate operation. But here's what wasn't thoroughly communicated. That malignancy would require 15 to 20 years before causing any complications. Thomas's reasonable life expectancy, approximately 8 to 10 years, considering his general wellness. Had he undergone the operation, he would have encountered permanent urinary leakage, requiring absorbent undergarments for his remaining lifetime, and sexual dysfunction, all for addressing a cancer that would never have affected him throughout his remaining years. Thomas selected active monitoring. 5 years forward, he's 85, still hitting the courts, living completely. The malignancy hasn't advanced. Had he accepted the initial suggestion, he would have lived these years experiencing complications for zero advantage. A significant research paper released in JAMA tracked 76,000 gentlemen and discovered that PSA screening in gentlemen beyond 60 delivered zero mortality advantage. Zero. Yet it produced substantial damage through excessive diagnosis and excessive intervention. The complications. Biopsies trigger infections in 2 to 3% of aging gentlemen, potentially life-threatening at that stage. Operations cause permanent urinary leakage in 20 to 30% of gentlemen beyond 60, and sexual dysfunction in 40 to 60%. All without survival advantage. Here's another reality. Post-mortem examinations demonstrate approximately 50% of gentlemen beyond 60 carry prostate cancer, yet most never create complications. You pass away with them, not because of them. PSA screening discovers these harmless malignancies, and physicians address them, producing guaranteed damage. If you experience symptoms, difficulty with urination, blood in urine, skeletal discomfort, testing becomes sensible. But standard screening without symptoms, the evidence is definitive. Avoid it. Questions to present your physician. What's my reasonable life expectancy considering my general wellness? Am I more prone to pass away with prostate cancer or because of it? What are the particular dangers of the biopsy? What does the research demonstrate for gentlemen my age? If your physician responds, it's simply protocol without addressing these inquiries. That's a warning signal. Test number 2. Routine colonoscopy after 65. Colonoscopy represents an outstanding screening instrument for colon cancer in younger individuals. Yet beyond 65, particularly if you've experienced normal colonoscopies previously, the dangers frequently exceed the advantages. The American College of Physicians advises against standard screening in individuals beyond 65 with typical risk who've experienced previous negative screenings. This represents an informal recommendation grounded in research. Here's the reasoning. Colonoscopy in aging individuals carries considerably elevated dangers. The sedation alone produces complications, disorientation, breathing complications, and tumbles following the procedure. For someone beyond 65, these aren't unusual adverse reactions. Then there's the procedure itself. The danger of perforation, a tear created in the colon, is 3 to 4 times elevated in individuals beyond 65. If that occurs, it demands emergency operation with a 10 to 15% mortality danger. You arrive for screening and conclude in intensive care. Bleeding represents another significant danger, particularly if you're consuming blood thinners like numerous older adults are. But here's the more substantial inquiry. What are you genuinely obtaining? If you're 65 with previous normal colonoscopies, the probability of forming colon cancer that will influence your remaining years is remarkably minimal. Colon cancer requires 10 to 15 years to form from a growth into a threatening malignancy. A JAMA internal medicine research discovered that colonoscopy complications in individuals beyond 65 resulted in hospitalizations in 5 to 8% of situations. If you experience symptoms, blood in bowel movements, unexplained weight reduction, then colonoscopy becomes sensible. But standard screening without symptoms and previous normal outcomes, the dangers exceed advantages. More secure options exist. Stool screenings like FIT or Cologuard can screen without the procedure dangers. Questions to present. Considering my previous normal colonoscopies, what's my genuine danger? What are the complication dangers at my age? Are there less invasive options? Test number 3. Routine mammography after age 65. The third screening to challenge is standard mammography screening beyond 65. Comparable to prostate cancer screening, breast cancer screening in very aging women frequently produces excessive diagnosis and excessive intervention of malignancies that would never create complications throughout their remaining years. A research paper in JAMA Internal Medicine analyzed mammography in women beyond 65. They discovered that while mammograms identified numerous malignancies, addressing those malignancies didn't enhance survival. Rather, it resulted in operations, radiation, and chemotherapy that diminished life quality without prolonging it. Let me share the story of Eleanor, an 83-year-old woman without symptoms. A standard mammogram discovered a tiny, slow-progressing malignancy. Her cancer specialist advised operation, followed by 6 weeks of radiation. Eleanor had diabetes, mild cardiac condition, and early kidney complications. A reasonable life expectancy was 6 to 8 years. The malignancy they discovered would require 12 to 15 years before producing any symptoms. Had she experienced intervention, she would have lived months recuperating from operation and radiation. The radiation would have produced exhaustion, skin irritation, and potentially aggravated her cardiac condition. For what purpose? To address a malignancy that would never affect her. She selected active monitoring. 2 years forward, she's 85, living completely, and the malignancy hasn't advanced. But here's what occurs to most women in Eleanor's circumstances. They receive, "You have cancer," and become frightened. They consent to operation, radiation, even chemotherapy. Their life quality collapses, and it doesn't contribute a single day to their years. The information demonstrates that for every 1,000 women beyond 65 screened, approximately 5 to 10 are identified with breast cancer. Of those, only 1 to 2 genuinely benefit from intervention. The remainder experience intervention that damages them without assisting. Breast cancer interventions in women beyond 65 produce substantial complications. Operation complications rise with age. Radiation can aggravate cardiac conditions. Chemotherapy produces cognitive deterioration and tumbles. If you experience symptoms, a mass you can detect, nipple discharge, skin alterations, then testing becomes sensible. But standard screening without symptoms and typical risk, the research states it produces more damage than benefit. Questions to present. What's my reasonable life expectancy evaluating my general wellness? Would addressing a slow-progressing malignancy prolong my life or simply diminish my life quality? What are the intervention complication dangers at my age? Test number 4, aggressive diabetes screening with overly strict targets. The fourth screening to challenge is intensive diabetes screening with excessively rigid blood glucose objectives in aging individuals. Diabetes oversight is significant, yet remarkably tight glucose management in fragile aging individuals produces more damage than advantage through threatening hypoglycemia, low blood glucose. For years, the medical benchmark has been maintaining hemoglobin A1C beneath 7.0. That objective functions for younger individuals. Yet for someone beyond 65, particularly if you're fragile or possess other wellness conditions, that objective can prove lethal. Numerous research papers have demonstrated that intensive glucose reduction in aging individuals raises mortality rather than lowering it. You heard correctly. Attempting excessively diligently to reduce blood glucose can genuinely prove fatal. Here's the reasoning. When physicians pursue very tight management, they prescribe elevated doses of diabetes medications. Those medications can drop your blood glucose threateningly low. For someone beyond 65, hypoglycemia produces disorientation, lightheadedness, and tumbles. A tumble frequently signifies a fractured hip, which carries a 20 to 30% mortality rate within 12 months. Serious hypoglycemia can also produce cardiac events, strokes, and cognitive deterioration. I encountered a 77-year-old woman named Patricia. Her physician continued raising her medications to achieve her A1C beneath 7.0. She began experiencing dizzy episodes and tumbled twice in 3 months, breaking her wrist the second occasion. Her A1C was 6.8. Her physician was satisfied. But Patricia was experiencing frequent low blood glucose episodes. Her life quality had deteriorated. We diminished her medications. Her A1C rose to 8.0. Yet the dizzy episodes ceased. No additional tumbles. She could exist independently once more. The American Diabetes Association currently advises relaxed glucose objectives for aging individuals with restricted life expectancy. An A1C of 7.5 to 8.5 is suitable for numerous older adults. Nevertheless, physicians still pursue lower figures. Here's the truth. For someone beyond 65 with restricted life expectancy, the theoretical long-range advantages of tight management don't matter. Those complications require 10 to 15 years to form. Yet the immediate dangers of hypoglycemia are authentic and threatening immediately. Questions to present. Considering my age, what glucose objectives are suitable for me particularly? What are the dangers of hypoglycemia with my present medications? Would a more relaxed objective be more secure? Test number 5. Routine CT and PET scans for cancer screening. The fifth and concluding screening to challenge is standard CT or PET scans requested simply to examine for cancer. Unless you possess particular symptoms or identified cancer, these scans are wasteful at minimum and damaging at maximum. Initially, the radiation exposure. A single PET scan exposes you to 25 to 30 millisieverts of radiation. The typical individual receives approximately 3 millisieverts annually naturally. One PET scan delivers you nearly 10 years' worth of radiation in one session. Medical authorities concur that 100 millisieverts substantially raises cancer danger. 3 PET scans, and you're nearing that threshold. You're receiving scanning to search for cancer, while raising your danger of forming it. Yet the more substantial issue is what these scans discover. They're remarkably sensitive. They identify everything. And in aging individuals, that signifies numerous abnormalities that appear concerning, yet are genuinely harmless. These are termed incidental discoveries. A JAMA internal medicine research discovered that incidental discoveries from imaging resulted in follow-up biopsies and procedures that produced complications in 23% of situations with zero survival advantage. Here's what occurs. The scan discovers a small mark on your lung or kidney. Your physician states, "We must investigate." Additional screenings follow, perhaps a biopsy with dangers of bleeding and infection. Then the outcomes return benign. You've experienced invasive procedures and worry for nothing. Or they discover something that's technically cancer, yet so slow progressing it would never create complications in your remaining years. Yet once discovered, physicians feel compelled to address it. I witnessed an 84-year-old gentleman named Walter, whose CT scan discovered a small kidney mass. Additional testing verified slow-progressing kidney cancer. His urological specialist advised operation to extract the kidney. Yet Walter possessed cardiac condition and diabetes. The operation carried a 15% danger of serious complications. That malignancy would require 15 to 20 years before producing symptoms. Walter's life expectancy, approximately 5 to 7 years. Walter selected not to undergo operation. 3 years forward, he's 87. The malignancy hasn't expanded. He's existing without the complications operation would have produced. If you experience symptoms, unexplained weight reduction, persistent discomfort, targeted imaging becomes sensible. But standard screening in symptom-free aging individuals, avoid it. Questions to present. What particular symptom makes this scan essential? What's the probability any discovery would prolong my life? What's the danger of damaging follow-up procedures? Final thoughts. So, we've examined 5 screenings frequently unnecessary beyond age 60. PSA screening, standard colonoscopy, standard mammography, intensive diabetes management with tight objectives, and standard CT or PET scans. These aren't marginal perspectives. These are formal suggestions from significant medical organizations. The research is definitive, yet most physicians don't explore this with aging individuals. Before consenting to any screening beyond 60, present 3 inquiries. 1. What's my reasonable life expectancy considering my general wellness? 2. If this screening discovers something, what would intervention involve, and what are the dangers? 3. What does the medical research demonstrate for individuals my age? If your physician can't respond to these thoroughly, that's a warning signal. You possess complete authority to challenge medical suggestions. Medical attention beyond 60 should emphasize your life quality, not checking boxes on procedures constructed for younger individuals. The objective isn't to exist eternally. The objective is to exist well for as extended as you possess. Sometimes that signifies declining screenings that don't fulfill that objective. If this was helpful, please like and share this video. Thank you for watching.